The government also sees the single patient record as kind of essential for future health planning, for delivering a neighbourhood NHS, also for leveraging the power of new tech and AI in terms of, increasing productivity, secondary prevention of disease, all sorts of things, really. I think it really underpins a lot of what the government wants to do. The government says that support for a single patient record is pretty widespread among the public. And I think it is. There's no doubt that some form of data sharing would help improve care, help with things like population health management, research, all sorts of things. But I think, there are some pretty significant caveats to that. I was at a King's Fund webinar about the bill, and one of their experts was talking about this. And he was saying, while patients are supportive about the single patient record, that's very much based on conditions such as transparency over who's accessing their information, accountability for what happens if things go wrong, and having a choice about how their data is shared. And I think there will be some flashpoints as the bill moves through the Commons and the Lords about some of these things and whether the bill adequately addresses those concerns. And I think the public might also become more concerned about some of these issues. It's one thing, having an arm's length body like NHS England or the NHS being responsible for a single patient record, perhaps quite another for the government itself to be responsible for it. And some people, they might feel a bit less confident or a bit more uncomfortable with sharing their data when they realise that that's what the bill is effectively doing. It's giving the government control of this.
It's interesting, isn't it, on a macro level? Back in 2012 with Andrew Lansley's reforms, the big concern was all about he's handing over power to other people, responsibility to other people. He doesn't want to take responsibility for anything. The health secretary won't be able to be blamed for anything at all. Yeah. And now it's all about, the health secretary's, this is a massive power grab, taking control of everything. So it's the diametric opposite. But these poor politicians, they can't win, can they?